Thank you again for having us. We're very excited to be here. I'm going to stand off to the side just so I can help with the PowerPoint. I'm here to provide an introduction to the Minnesota Medical Cannabis Program. This is an overview. It's kind of a nice visual for the United States and where different states are with medical cannabis. As you can see, the states in red have not only medical cannabis, but they do offer recreational use as well. The green states, which do include Minnesota, are medical cannabis states. And then the blue, where it says limited products allowed, that means CBD and whatnot. And so in 2014, Minnesota became the 22nd state to form a medical cannabis program. So if you think about it, that was May of last year. We've gotten a lot done, and we're excited to be here. A brief history on medical cannabis in Minnesota. In 1980, there was the Therapeutic Research Act. Now that was never implemented and whatnot, but fast forward a few decades to 2009, legislature did pass a bill that would allow the terminal patients, but it was vetoed by Governor Pawlenty. Then we come back to just a year ago, in 2014, there was intense lobbying by parents. They brought up their children that were having seizures, and what happened is when their children would have seizures, they didn't leave the room. That everyone witnessed what their children were going through. So the governor did direct MDH to work on a proposal, and we did craft a proposal, and a compromise was reached May of last year, and the bill was actually signed May 29th of 2014. I do want to touch point on the intent of our law. Given that there are so many medical cannabis programs across the U.S., it's important to stress, what does Minnesota do with our medical cannabis? It's truly designed to enable sick patients to engage in the therapeutic use of cannabis, but we still want to prevent the misuse of the cannabis as well as any diversion. What is medical cannabis? Well, it's cannabis used for a medical purpose. Cannabis in our state needs to come from one of our two manufacturers. They are Leafline Labs and Minnesota Medical Solutions. Also, what's very different in our state is you can't smoke it. There's no plants, nothing like that. The allowable forms are pills, oils, and vaporizers. And unlike some states that have reciprocity with their cannabis programs, we do not here. You need to be a Minnesota resident. Who may possess medical cannabis in Minnesota? That it would be a registered patient, parent, legal guardian, caregiver. There isn't a program card here. I just touch point on this here because a lot of states do have program cards. And here, what shows you are registered is not only the proof in our registry, but your medical cannabis, the dosage itself. Manufacturer employees in the course of their employment, lab employees who do test samples of the medical cannabis, as well as healthcare facility employees. Now that is new, and that is while they're carrying out employment duties. So providing or supervising care to a registered patient or distribution of medical cannabis to a registered patient within their facility. This is our qualifying medical conditions list. I'll kind of go through it, and then I have some details to add in later. It's cancer, glaucoma, HIV/AIDS, Tourette syndrome, ALS, seizures, severe persistent muscle spasms, Crohn's disease, and terminal illness with a life expectancy of under 1 year. And cancer and terminal illness both have asterisks next to them, and as you can see, right below terminal illness, it's severe and chronic pain associated with cancer or terminal illness, nausea or severe vomiting associated with one of the two, and cachexia or severe wasting associated with one of those two conditions. MDH can add additional conditions, but as Michelle had introduced in the beginning, intractable pain must be looked at first. Speaking of intractable pain, I'd like to give a little bit of history on intractable pain and actually where our office is with it today. MDH did form an advisory panel. It consists of 8 members. And we have all the information on our website too, so if you want to visit, we've got great information there. Intractable pain, they had their first meeting, the advisory panel, on June 15th. They have their second one on September 3rd, which is available for public testimony. So if any of you are feeling moved to share your story or publicly testify, I would recommend it. It is next Thursday. You can come visit me after if you want to know the exact location. I have the address, but it also is available online. And then they'll have a third meeting in October sometime. That date has not yet been set, but also open to the public. Anyone that's interested can attend. And then they will give a recommendation to the commissioner. And the Commissioner on January 1st of 2016 will announce if intractable pain will be added or not added to our condition list. Patients. Patients need to be a Minnesota resident with a qualifying medical condition, enrolled in our registry. They also need to agree that state can use some medical data for aggregate reports and research. They also will pay an enrollment fee of $200. That does drop down to $50 if you are participating in a medical assistance program. And there is no insurance coverage, but manufacturers do provide discounts, or they're trying to offer a sliding scale for those that qualify. Healthcare practitioners. We get a lot of calls in our office and in our call center about who qualifies under the healthcare practitioners, and it's important to note that there's 3 different individuals: a Minnesota licensed doctor of medicine, a Minnesota licensed physician assistant acting within the scope of practice, or a Minnesota licensed advanced practice registered nurse, an APRN. Now, with all 3 of these, they need to have the primary responsibility of care and treatment of the underlying qualifying medical condition. What are the healthcare practitioner's duties? If you think about when you go to your healthcare practitioner right now, you're not feeling well, you're under the weather, they usually give you a prescription and you take it and you get it filled at Walgreens, CVS. It's different here. The healthcare practitioners in our program, what they do is they certify the patients with the condition. It's the pharmacist, and I'll discuss that later on, that is the one that helps determine the dosage based on what current medications one may be on and what their condition is. They also, in addition to certifying the diagnosis, they can certify if this patient needs a caregiver or not, because that's something they fill out and they're part of the registry. They also need to provide ongoing treatment. This is crucial. We want to be able to partner everyone together and truly make this successful for the patient. They also will provide access to health records to MDH, and they are responsible for the annual recertification. So even though the patients are registered in our program, you do need to recertify every year with your healthcare practitioner. What is important to note is participation is voluntary. So as you may have noticed, we have a great number that are now applying to be part of our program, and it's growing, but it is voluntary. It's not required of all our healthcare providers. Touching base on our registry, I'm actually going to go forward a slide, which is so everyone is aware it is a secure registry, and the Office of Medical Cannabis is responsible for maintaining the registry. No one is able to access the registry without a valid search warrant. That comes later on, but just as a note. This is a great visual for our registry and actually our program in its entirety. I'll kind of go through a scenario. If an individual feels they have a qualifying condition, they will go and meet with their healthcare practitioner. If their healthcare practitioner certifies them with that condition, what happens next is the healthcare provider will go and enroll to be part of our program. Once that happens and they are approved, they will add a patient on their profile home screen, and that's also where they will add a caregiver if that patient is in need of one. Once that happens, the patient will receive an automated email, and for those that don't have access to email, internet, or computers, always feel free to call our call center. We have a great team there that are always willing to send out hard copies of the documents so everyone is able to participate that needs to. Part of the registry for the patients is that they have proof of ID and then they go through payment, all while they're registering themselves. Once that patient is approved, that's when they have the ability to go to one of the cannabis patient centers. We have 8 that will be open in 2016, July, and right now there are 3 that are currently open. And again, at the bottom, what's very crucial is there's no smoking and no plants in our program. It's all pill, liquid, and oil forms. I thought I'd offer some program statistics since our program is something that a lot of people are interested in. As of last Friday, August 21st, we do have 361 patients and 370 healthcare practitioners. We're growing, we're moving, we're getting out there, we're educating, we're trying to provide as much information as we can because we truly believe we have a great program. And this information is always available on our website. Should you ever want to kind of see where we're at with our program, it also lists how many caregivers are enrolled and everything. As of August 3rd, the beginning of August, these were the 3 most frequent conditions that patients were registering our program as. Muscle spasms, including multiple sclerosis, seizures, including those characteristic of epilepsy, and then severe chronic pain associated with cancer or terminal illness. This is a visual of our cannabis patient center locations. It was divided based on the congressional districts. So each manufacturer not only has a cultivation and production site, but they have 4 cannabis patient centers. So they're divided between the 4 of them. The current ones that are open, and I'll say on the slide in a couple, I believe, and coming up, Minneapolis, Eagan, and Rochester are the current ones that are open. I wanted to provide some information about our manufacturers, who they are, where they're located. This is Minnesota Medical Solutions. That's the CEO, Dr. Kyle Kingsley. The Chief Medical Officer is Dr. Laura Bultman, and as I stated, actually, back the screen, that is a photograph of their cultivation and production site in Otsego, Minnesota. And then their 4 cannabis patient center locations are listed: Moorhead, Minneapolis, Rochester, and Eden Prairie. The 2 underlined are the 2 that are currently open. Going forward, I'm going to also talk about Leafline, our other manufacturer, but if you ever want to know the status of the cannabis patient center locations, we also have all of that online, or feel free to call our call center, and we can always update you. Leafline Labs is the other location, and their president is Peter Bachman. The CEO is Manny Munson-Regala, and their chief medical officer is Dr. Andy Bachman. Their head cultivation and production facility is in Cottage Grove, Minnesota. And then these are their 4 cannabis patient center locations: Eagan, Hibbing, St. Cloud, and St. Paul. Eagan is the one that is currently open at this time. Providing a little bit more insight into the manufacturing facilities and the cannabis patient center locations, each manufacturer, as I stated earlier, has 1 indoor cultivation and production site. And then they have 4 cannabis patient centers, that need to be open by July 1st, 2016. They cannot operate within 1,000 feet of a public or private school. Both manufacturers need to meet security requirements as well as signage restrictions, and the consumption of medical cannabis is absolutely prohibited on site. Even though there's no smoking and no plants in our program, the pills, liquids, and oils forms do come from the plant itself, so I wanted to talk about the extraction and refining process. The plants go through a harvesting, and then a drying, a cutting and shredding process, which then leads into that CO2 extraction. So if you envision something really cold, that's the type of extraction these plants are going through. And then they either go through a separation or a mixing process. It depends on if specific cannabinoids need to be isolated or the ratio of THC to CBD needs to be altered.
You're talking about oil. Is correct?
Yes, correct.
Sorry.
No, not at all. Discussing a little more detail in the product composition. Oh, yes. Yes. No, it's okay.
What was the question?
What was the question again? It was discussing how it's when they go into the oil form, the plant.
Yeah.
Yes, so this screen right here is talking about the extraction and the refining process of the plant. I'm sorry, I can't see who asked the question. I apologize. Extraction and the process from the plant into the oil, the liquid, or the vaporizer.
I only say that because they said I got called 3/4 of a pound of marijuana that was shredded. And it was in a big jar. And we were going to use it to bake oil. But I'm not permitted to do these types of things. I wasn't here at the beginning.
It's okay.
To interact. I would do so.
No, that's okay.
Last questions.
Well, we also have questions and answers, and I only have a few more slides, but if you want to... Go ahead.
Because we're recording it, if it doesn't go through the mic, we can't hear it.
Okay.
Well, just wait. Why don't we wait till the question period?
Right during the question and answers, we'll allow anyone that wants to come up, or we'll bring the microphone to you, and anyone can ask any questions or provide.
Yeah, no
No,
problem.
not at all. Thank you. Product composition. So obviously there are different medical cannabis products in Minnesota based on condition needs and everything like that. And they're characterized by different ratios of THC to CBD. Some of the current ratios, we just gave examples of what our current products are. 100% THC, 75% THC, 25% CBD. Can be an equal down the middle, 50% THC, 50% CBD. Or it can be on the lower end of THC, 25% with a 75% CBD, or 100% CBD. The 2 manufacturers are the ones that are determining their product line, which can evolve over time. But each product is intended to remain consistent as long as it's being processed. I want to touch base on independent lab testing. Minnesota Department of Health did approve 2 labs, Aspen Research Corporation, which is located in Maple Grove, and Legend Technical Services in St. Paul. These are labs where the manufacturers will be providing their medical cannabis samples up to be tested, whether it be for the content, cannabinoid profile. They're looking for contamination of metals, pesticides, microbials, residual solvents, looking for consistency and stability through random audits. And the Commissioner will publish a list of analytes and tolerance levels that is currently in progress. Packaging and marketing is important because we are taking a medical approach to the medical cannabis program here. We want to make sure the packaging is plain to minimize appeal to children. We want it to be tamper evident, child resistant, name reflects the medical cannabis nature. The label needs to contain the chemical composition, the dosage and directions, dates of manufacturers. Each medical cannabis dose will contain a batch number, and that is to track in case of any adverse events and whatnot. The patient name, date of birth, address, as well as a caregiver, if there is one, and their date of birth. Dispensing, going back to the example of how our program is different than other prescriptions that you may see, is a Minnesota licensed pharmacist, which will be present at one of the Cannabis Patient Center locations, is responsible to determine the dosage and the composition of the medical cannabis for the patient. They also dispense the medication. And the maximum supply that a patient can receive of medical cannabis is a 30-day. That does vary from patient to patient. Some patients have 7-day supplies, others maybe do 10 days, 14 days. Whatever works for that patient, their condition, it is something that they discuss with the pharmacist at that time. Tracking number is assigned, again, like I said, and insurance does not cover the cost of medical cannabis. A very important part of our program is that we want to track the experience of our participants. We want to know what the patients are feeling and experiencing. So unlike any other state, what happens is when the patient goes in to receive their medical cannabis dosage, they do fill out a self-evaluation form every single time to discuss any side effects they may have had, any benefits, what other medications are on. This is what allows the pharmacist to help make the best determination of what the next dosage will be. It is from this self-report data that observational research will describe indications of benefits or side effects at what levels or what dosages. And then later, there is an opportunity to enhance observations with clinical information from medical records. Right now, the reporting of serious adverse events needs to go to the manufacturers because they are the ones that are investigating it. Obviously, if a patient is having a reaction, always call 911, but it is that hope that it is reported to the manufacturers because they will be investigating that report. Rulemaking. There are 2 sets of rules. There are the patient rules and the manufacturer rules. They are both available on our website, the updated. If you have any questions, feel free to ask after, but some rules are already in place, but because the rulemaking process is ongoing, we always encourage public comments. Any questions?